Okay, this is my next surgery update video and what's been happening the last month and whatnot. It would be not this Friday, but the next Friday on the 10th is when I see the doctor, the surgeon, for my 3-month post-op checkup, and hopefully everything's all good. One thing physically I've been experiencing I don't like is some of the pain I've been having on the left side. The best way I can describe it, it's not happening all the time, just here and there. That feeling, the best way I can really describe it, which I've had this pain before, I mentioned with my initial surgery. That pain, it's up inside the cavity, like you've been kicked in the testicles, I can say. It's kind of pain like that, but not as severe as that would be of the actual feeling of it. It's just like a milder pain of that same sensation, which sucks. Let's see how everything else is healing. Here and there, just a little bit of like stinging, or just, yeah, pretty much stinging, I can say, a little bit. And how things are healing more so, where the stitches were next to, it's like up closer to where the clitoris is, up towards, next to the clitoris urethral opening area, more towards the urethral opening. Where those the stitches were in that spot, there's still some slight indents in those two spots, but overall it's pretty much healed. And where my labia minora was lifted, where the stitches were in those two spots, on one on each side, you can see, looks like a little nub on each one. That's still there. The asymmetry is still there, where the right side's longer than the left, which I'm actually comfortable with that for some reason, even though I prefer to have them even, but I'm happy with what I have, because having it, that asymmetry for over a year, I've gotten used to it. And that's just how my body is and just how my body healed. And if that's how my body healed, even after having revision and you tried fixing the asymmetry, and if that's how my body healed, that's how my body's supposed to be. So I'm happy and comfortable with that. And especially where the fat is, it's, even though I have more significant labia minora, which that doesn't happen very often in trans women who've had the surgery, which is what he initially said with my initial surgery, and it's more prominent, that it's there since it's been lifted. And my labia majora, there's like no more swelling. There's still fat there, but it's not, it doesn't seem like I have a huge amount because of the swelling being down and the fat, how it's softened. I'm happy about that, how it's like soft and squishy instead of being hard like it was. The one thing I've noticed with my labia minora, what had to be done to lift it up or to help keep it lifted, was that extra like skin or whatever they put inside of it to lift it. And I think it was the excess erectile tissue I had, instead of getting rid of all of that excess, some of it was used to help lift that up, is what it feels like. The thing is, with it in there the way it is, it's helps in the overall look of everything, even though the clitoral hood and the labia minora are connected, and there's not much, like 100% separation, but you can tell which part's the clitoral hood and the labia minora, just the way things are shaped. So it just looks normal, it feels normal. And one thing I've been really noticing lately that's causing lots of emotions, good emotions, but emotions I have to deal with that I have a hard time dealing with because having autism, part of my autism, I have alexithymia. Yeah, alexithymia, which makes it hard for me with emotions. It's mostly emotions with myself when they're mixed emotions, but overall, since having revision and more healed, it's more functional. And that functionality part is what's getting to me a little bit with the emotions, trying to deal with the emotional part of it. Because compared to before revision, compared to now my labia minora and labia majora actually swell up sexually. And I've been noticing that a lot lately when it happens within the last month. And because it's functional that way, it's causing sometimes mixed emotions or just happy emotions where it's hard to have to process it, because not having that for so long in my life, my body being able to be functional like that in the way it is now, and could be probably from past trauma, from not having correct genitalia for so long, and it's just a bunch of factors. But overall, that's something I'm happy and glad that is able to happen, because I never thought that would ever happen with my body. And how they did the revision with the surgeon and the urology team, both together, both the teams. What I've been thinking, all trans women who have the surgery needs to be done like this, because how functional it is. Yeah, when it's dysfunctional, it's a blessing in disguise. And I'm much more happier with my body because of it. It's just really hard to deal with sometimes. But the thing is, I don't want it to ever go away. I don't want to ever go back, which is pretty much impossible. But the thing is, where everything is at now is perfect. For me, it just feels perfect. And I've also been noticing the vaginal canal. It's not tight anymore. That swelling's gone. And there's been times when I dilated or toy, I can say. It's just slipped right in with no issues. So I'm back to where I was right before revision, with my canal not being tight. So, yeah. And all I can say is the orange dilator, I can actually take bigger than that. Because like the skin, or like the vaginal lining, like the canal and everything is actually stretchy. And one thing I've been noticing, without that excess erectile tissue, the spongy corpus, the vaginal opening looks and feels more normal, and there's no obstruction, so that makes that much easier and less issues. And the way it feels, I can say, like, sexually, it feels even better without having that excess tissue obstructing things. And at times I've been noticing I've been able to actually feel more inside my vagina, I can say, the canal. I can actually feel even more. There's times, like, when my body's really sensitive, I can feel it a lot more inside than when my body's being less sensitive. But overall, I've just been noticing every little detail, every little thing improving in that area, like the pelvic floor, like genitalia area. Like, for instance, the urinary issues I had before surgery, the initial surgery, it's even more fixed with the revision. I'm having even more or less issues with that than I did before the revision. Because before the revision, it was just a little bit of issues here and there. If I had to really go really bad and didn't get there in time, there was some issues of, having a hard time being able to hold it. But since the revision, which that didn't happen very often before the revision, but after the revision, as things were healing, it's happened like once, maybe twice. Other than that, I haven't had issues since things have healed. So that's another blessing, and I've been noticing I'm able to hold it a lot easier and a lot better, the way the female body's supposed to be able to, so it has less issues, in that kind of a way. So yeah, so there's actually a lot of benefits from my experience with the issues I've had. There's been a lot of good that's come out of having this surgery. And even though people say what they say, it's actually, for trans women, it's actually necessary and beneficial for us who need the surgery to have the surgery. Like in my case, how I absolutely needed the surgery for tons of different reasons. Anywhere from like the urinary issues, my dysphoria. It was like a life-saving, having both the surgery and revision, and having everything corrected visually and part of it functionally because of that excess tissue, getting rid of it. My dysphoria is just pretty much from my genitalia gone. I just get emotional with it because the way it looks and the way it functions and that mind-body connection, I'm happy with it and get really emotional at times, just because it's what my body was supposed to be, should have been born with. Plus some of the issues I had before, I really never mentioned. But thing is, some of those other issues doesn't affect how it is now. So yeah, like the one thing I rarely mentioned was before surgery, the tip of what I used to have had 2 holes, and how it kind of on hormones looked like an upside down vulva, kind of the way mine looks now. Kind of, but not sort of, but in a peony shape, I can say. But with the surgery and revision, that didn't really affect anything. So yeah. So having everything corrected and things placed where they're placed, and I've been just noticing little things here and there. It's like just the simplest thing I've noticed this last week, or 2 weeks I should say. Just going pee, just using the bathroom just to pee, compared to before surgery, the initial surgery and revision. It's like now it feels normal, and I'm not having dysphoria from it because the clitoris and the urethra are separated and not connected. And before, when everything was connected the wrong way, the way it should have been, the way it is now, how it was connected the other way, because before it would cause dysphoria because my body would give me feelings and signals where everything's structured now, like afterwards. And now, because it's physically where it is now, I don't have that dysphoria. It's gone. And it's been gone for quite some time. And since the revision, it's further gone. That dysphoria is further gone. And I'm just really happy with having it done. I don't regret it. If I can say only one regret, it's not having it done sooner. But it happened when it was supposed to happen. So yeah. Other than that, everything seems to be really good, really functional. Everything from the vaginal canal, how I'm able to feel it, how it's functioning, the clitoris, the clitoral hood, the urethra, the labia minora and labia majora, it's all functional the way it should be. And since all the swelling's gone down, and I've been noticing that I can't say my vaginal canal is self-lubricating per se, but it is moistened skin, and mostly more so when aroused or getting that sexual pleasure, I can say. Recently, noticing need less lubricant, I can say. And that when my body releases the fluids, mostly I could say from like how some trans women experience it from the urethra when it releases, whatnot, and don't need as much lubricant. And also the fluids the vaginal canal produces, well, as much as it can, because don't have certain parts like the Bartholomew glands. Those are the parts that they can't do, that actually produces the actual fluids sexually in the vagina. So the way it happens it slightly differently. So yeah, other than that, it's more perfect and more amazing than it was before revision. And I wish I was able to have what I have now. If they could have done what they did with the revision at the same time as the initial surgery, it would have been even more amazing. But because there's only so much they can do with one surgery and how the body has to heal, it was worth getting the revision to have everything fixed and corrected. And just the most gender affirming or gender euphoria moments I've been having too lately. Wearing pants. Just being able to wear pants. Even if I'm sexually aroused, I can say. And the way it feels with the way my genitalia is now, it just gives me that gender euphoria. That's been happening a lot lately. It's like when I notice it, I'm like, I'm noticing this fits the way it should fit with the way my genitalia is. Even though I have more labia minora, and at times it does, like the way pants do fit, at times it does show through, I can see, with the roundedness. Just little euphoria moments like that, and it's just like, wow, it's not even the same as before surgery. And it just looks normal, it feels normal, and even more so than before the revision. Now, since having the revision healed to where it's at, my body, how I mentioned before in a past video, how my body does turn me on, it does even more so since having revision, and the way clothing fits and the way it looks on me, and how much more better I feel because of it. And I can say I have a little more confidence with my body and being able to wear certain clothing I wasn't able to wear before compared to then and now. It's just a huge blessing that happened when it happened, and I don't regret it at all. So, from my experience, I can't speak on any other person that's trans, only from my personal experience. It's the best thing they can do, even though I can't say it's 100% perfect, or it's like the most perfect vulva in the world, the most perfect vagina. For me and my body, it's 100% perfect for who I am in my body, even though it may or may not be the most perfect in the world. It's 100% perfect for me and my body and how I feel with it. And for those who do struggle, even if you've had surgery, just remember it's your body and it's what you need, and what you're going through is you. You can't base this off what other people go through, even though it's kind of like a similar experience, even though some things are different and some things are the same. It's your body, just like mine is mine, and mine's like more perfect than what it was before. Yours is yours, no matter what people say. And just be happy with what you haven't have been able to achieve so far. And once you get to that final goal, just remember, it's your body, not anyone else's. And what's right for you is not right for anyone else. Just like what's right for my body is not right for anyone else's. So yeah, other than that, we just have to see when I get that doctor's visit next week. So just to find out how things are going and everything. So yeah, other than that, until my next video, if you have any questions I never answered, please ask. Because if I get enough questions, I will do a video. If I get enough of the same question asked, or I just might do a video on it anyways. So, please, if I never answered anything like related to my transition or other people's what they've gone through, if you have any questions on things what trans individuals go through, I should say, and I can only answer it from my experience. So until my next video, comment, ask questions, give me thumbs up, and subscribe to this wonderful channel. And until then,